What are the most important things that our audience needs to know about this new regulation? I know I just rattled off a few things describing it, but from your perspective, what do they need to know? What should they be thinking about?
Well, thank you for the intro, and yeah, that's a lot. I think we are covering most of that in the next hour. But to give it a head start, yes, indeed, it has entered into force January 31st this year, after a long implementation time already existed in 2014. And what is really important to know that now it's here to stay. So no more delays in implementation. January 31st was the start of the transition period. And what's also interesting and good to know is that this is not an iteration of the EU Clinical Trial Directive. It's a brand new regulation, and it will have massive impact on your business processes, internal communication, the way of working with CROs, and it will definitely also change, and I'm really curious what the people say in the poll, how people and how companies will prepare for clinical trials. I expect a shift in responsibilities from affiliate offices to headquarters, and it has a massive impact on IT systems and how they are used within your organizations. So summarizing, what the EU clinical trial regulation does is it enables sponsors to apply for CTAs, for clinical trial authorization, in 28 European countries and associated countries in the EEA, with one single online application. So no need to submit multiple dossiers. It allows regulators to work together, and with that, it enables, with the CTIS, it enables transparency and access to information by the public, so by patients, physicians, and I think that is one of the main goals of the CTR as well, to make it more transparent.
Okay, and can we quickly take a look at those, the results of that poll question? So it's a pretty even split. Very few people feel that it's not going to impact the way they prepare for studies, but about half the audience says it will, and the other half are still unsure. Hopefully, by the time we get done going through this topic today, a lot of those who are unsure will have a better idea of that. Marieke, let me stick with you for one additional one here. I think a lot of people are still unsure about why the regulation was put in place. Why are we making the change, and why was it necessary to do this? Can you share with us what you feel the main reasons are for the regulation being put in place?
Yeah, definitely. For us in Europe, it was a must to have this new regulation, simply because since the implementation of the EU directives in 2001, 20 years ago, there was a decrease in the amount of clinical trials in Europe, because the EU directives try to harmonize the way clinical trials are submitted in Europe, but it wasn't successful. The system of submitting and managing trials in the member state was too diversified, and the administrative burden was even increased instead of decreased. So seeing that within the EU, there had to be change in the way the EMA approached this regulation. And since a couple of years after the directive, this new regulation has been written and went live in 2014. To put it in numbers, there was a reduction in the number of applications for clinical trials in the EU by 25%. Which is massive and well, quite devastating for Europe. So this CTR needs to change that, and it must raise the attractiveness for the EU for the conduct of clinical trials. So with this, we hope that we come closer to the study startup times that are reached in the US and other regions, and we hope to have a faster application and assessment procedure than previously, so then under the directive. because it used to be like 1 year. It took a year when to get the first patient in the trial, which is far too long. So it's all of that that needs to be solved, and CTR is going to help us with that.
Yeah, that's a 25% drop in applications is a very significant number, and realize this was probably happening at the same time that we saw other areas of the world growing. I mean, APAC, we keep hearing is a very hot region right now. And I think a lot of the growth in China was due to changes in regulations that they made back in 2018, I believe. So seeing that drop had to be concerning, especially when you see other areas growing. So that certainly indicates to me that something was necessary and that they had to do something to change that. Adam, let me go ahead and jump to you. The intent behind the regulation is to ensure that rules for conducting clinical trials are identical throughout the European Union and the European Economic Area, and allows for coordinated assessment of clinical trial applications between member states. One person did ask, though, about country-specific activities. I'm hoping you can talk about that a little bit, and will they still need to be complied with to execute a clinical study in EU member states?
Yeah, no, that's a good question. The short answer to that, is yes. The way that the CTIS is put together, there's part 1 and part 2 documents. So the part 1 documents are more of the centralized documents and EU specific requirements, but then there's still the member state specific documentation that needs to be put together, how you're doing, the fees, obviously, the translations that are going to be put together, informed consent, site suitability, all of those will be member state, specific type documentation. In addition, you have, the country specific rules and laws that are also going to have to be complied with. So that may be falling outside of the CTIS system or the CTR, but you still have to comply with local and regional laws, radiological sample handling, biological sample handling, things along those lines, data management, all of, so it's you still have to be aware and highly aware of the legal requirements of specific member states that you're putting your application into. But there is a place for a lot of that documentation in the CTIS, but there's still things that are going to fall outside the CTIS that sponsors are going to need to be aware of.